Good morning. Happy Saturday. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, Midtown Manhattan. I'm at the horse farm today and I'm bringing to you all things health related for women. It's Saturday. The girls do their horse riding lessons every Saturday. Joy has the lucky opportunity of being the only one in the ring right now. PID, that stands for pelvic inflammatory disease, and PID is a diagnosis that's made by a collection of problems. By a collection of problems, and PID is due to inflammation of the pelvic organs and tissues. And that inflammation is always due to a bacterial infection of the pelvic region. So I thought about speaking on PID today because quite often I'll have someone who's gone to the emergency room and then told to follow up here with me at the office, or at the office because I'm not at the office right now, but told to follow up with me at the office because they went to the ER for some kind of pain and the emergency room doctors told them that the pain was due to PID, gave them antibiotics and told them to follow up with their gynecologist. And I'm going to say, according to my evaluation, maybe 90% of the time that person doesn't have PID. So it's an overdiagnosed and misdiagnosed scenario, predominantly in the emergency rooms. It's a quick, easy answer, I think, and they can get the patient out of the ER quickly. So the incidence of PID is about 1 million women a year, or approximately 1 million women a year supposedly are diagnosed with PID in the United States. And that's PID affects about 5% of the female population. Sorry, I have allergies today. So pelvic inflammatory disease is predominantly due to an infection of the pelvic tissues from one of two sexual infections. Chlamydia and gonorrhea are the most common etiologies or sources of PID. And that's because everywhere in our body is a sterile environment. The only areas that are not sterile are the vaginal system and the intestinal system. So those are the only areas that are not sterile. They are supposed to have bacteria. They're supposed to have yeast, fungal elements, and they're supposed to be in a certain amount of balance, those two areas. Now the catch with PID is the vagina is a blind pouch. The only conduit or the only passage from the non-sterile vaginal environment to the sterile pelvic environment or abdominal body environment is the cervix and the uterus. So infections that occur in the vagina, the only way they can get into the pelvis is if they go up into the cervix and into the uterus. Now that being said, regular vaginal infections cannot climb on their own into the uterus. Yeast infections, bacterial infections, those have no way of climbing up into the pelvic tissues. But chlamydia and gonorrhea can potentially climb up into the pelvic tissues, and they can spread from the cervix into the uterus, through the tubes, out into the rest of the pelvic tissues, and they can cause an infection in what should be a sterile area. Now, the catch is, for God only knows why, chlamydia and gonorrhea do have the ability of climbing up into the pelvic tissues. So chlamydia and gonorrhea have a preference or a predilection for the cervical inner cells. So for the endocervical cells, they have a predilection for the endocervical cells, and they like to climb up into the cervix and set up shop. And once they've set up shop into the inner glands of the cervix, they like to slowly but surely climb up into the uterus, and from the uterus they can flow out through the fallopian tubes. Now, what happens is that endocervical infection of the chlamydia gonorrhea produces pus. It produces inflammatory fluid, suppurative liquid, or pus. And so it climbs up into the cervix, up into the uterus, and then it starts to develop into what we call a suppurative infection, where there's pus that develops. And then from the cervix and the uterus, that pus flows out of the fallopian tubes into the pelvis, and that's how you get a pelvic inflammatory disease. So the catch is 90% of women with chlamydia and gonorrhea don't have any symptoms, so they have no way of knowing that there's an infection brewing in the cervix or the uterus when they get it. And it takes a bit of time for it to climb from the cervical glands, endocervical glands, into the uterus. So chlamydia and gonorrhea are the most prominent sources of potential pelvic infection, or PID. After chlamydia gonorrhea is douching. Douching is where one takes a mechanism and washes out the vagina. So they put a tube in, wash out the vagina, and it's with a little bit of force. So they squirt the fluid in to wash out the vagina. With the squirting or the forcing of the fluid into the vagina, they can potentially shove or push with the fluid vaginal bacteria into the cervix, and then it can get into the uterus, and from the uterus it can climb up into the uterus. From the uterus it can climb through the fallopian tubes and out into the pelvis. Another way, so the first way is chlamydia, gonorrhea, that's 2 sexual infections. The second way is douching. A third way is having unprotected intercourse, even if that person doesn't have chlamydia or gonorrhea, but during the menstrual cycle, or even right after the menstrual cycle. And that's because the cervix is very, very tightly closed throughout the month. The only times that the cervix, so it's basically a barricade or a blockage, it blocks the vaginal environment from the uterine environment, which is a sterile, non-bacterial laden area. The cervix is very tightly closed and acts as a very good barrier throughout the month, except when someone's ovulating and when they're menstruating. So during ovulation, the cervix is slightly open to allow pregnancy to occur, because that's when everyone's fertile. And during menstruation, the cervix is also slightly open and loose to allow blood to be released, or the efflux of the menstrual cycle. So, if someone has unprotected intercourse where there's ejaculation and the semen is ejected into the vaginal canal, that's the same as douching, because you have a forceful amount of fluid washing around in the vaginal vault that's full of bacteria. Cervix is slightly open, so it's easy for that bacterial-laden fluid to get into the uterus. And with the blood present during the menstrual cycle, blood is a nutritional source for bacteria, and it creates more alkaline pH, which bacteria likes. So with the blood present, the bacteria has a much richer environment to grow, and it gets into the uterus, it grows, same story, suppurative, infection, pus, flows out through the fallopian tubes. That person has PID, or pelvic inflammatory disease. So, chlamydia, gonorrhea are the top reasons for PID. After that is douching at the wrong time of the month. Anyone who douches, they will usually douche in one of three scenarios. They'll douche after the menstrual cycle, because they're cleaning out the blood and slight odor that will last for a day or two with the menstrual cycle. They'll douche after intercourse for the same reasons, and they'll douche if they just randomly have a bad odor or discharge. So the only time that women who douche will douche is when there's bacteria present. So it's a bacterial-rich environment, and then they decide to douche. So tons of bacteria, high concentration, and they're washing it around forcefully in the vagina. So not ideal. So chlamydia, gonorrhea, douching, having unprotected intercourse with ejaculation, pushing bloody bacterial-laden fluid from the vagina into the uterus. So either during the menstrual cycle, which I guess has become more of a thing because women know they can't get pregnant, so they're more commonly having intercourse while they're bleeding, which is not smart. They know they can't get pregnant, so they're not using condoms. They're bleeding. That blood builds bacterial levels up to very high concentrations. Then that person is ejaculating in them and potentially pushing that bacteria up into the uterus. Or right at the end of the cycle, so the last day or two of the cycle, same story. It's too high of a concentration of bacteria present. It's a risk. And 90% of women who get chlamydia, gonorrhea don't know that they have it because they don't have any symptoms. Only about 10% of the time will it turn into a PID, or a pelvic inflammatory disease. And then lastly, the catch with PID is that by the time someone has symptoms, it's been present usually for quite a bit, at least for several days, usually for about 3 to 5 days on average. The infection has been brewing, starts in the endocervical glands, or in the cervix, quickly goes up into the uterus, and then it takes a couple of days for it to mature into a purulent or a suppurative or a pus-laden infection in the uterus, and then that pus or purulent liquid will flow from the uterus out through the tubes and into the pelvis to give the symptoms. So I'm going to stop right there today on what is PID, pelvic inflammatory disease, from a variety of different sources, predominantly chlamydia, gonorrhea, but a few non-sexual transmitted disease sources. And then on the next presentation, I'll come back with the signs, the symptoms, and then ultimately the treatment for PID. I hope that's been a helpful introduction to what is PID, pelvic inflammatory disease. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel. That's also GYN Corner. Check out the podcast. That's my daughter Joy. GYN Corner. And please hit the like and subscribe buttons. You'll get a heads up on the presentations when they're coming, what I'm talking about, and then please submit questions and place reviews to let others know why you enjoy GYN Corner. And also on Apple iTunes, place a 5-star review. It'll get other people to check out, hey, this person likes GYN Corner. Let me find out what's going on. They said it's great. Have a great rest of your weekend. It's really a nice day here in New Jersey. I have a sweatshirt on today, but it's actually getting pretty warm. I think it's going to get up to the high 70s, maybe low 80s today. And it's September, so we're quite